You've explained in a previous video that brain tumours can manifest in all sorts of ways and that there are many different symptoms. How do you, in fact, decide or diagnose whether someone actually does have a brain tumour?
There's the diagnosis of brain tumours. Often brain tumours, I have to say, are missed because, as we know from the diversity of symptoms, not all of these are going to be investigated because if the patient may not, if they're mild, may not even go to the doctor or optician or do anything about it until they're extremely unwell. And particularly with behavioral changes, they themselves may not realize they are different, and their family and friends notice it only or describe it retrospectively. They sort of feel there's something different, but it could be just the man having a mistress. So he's different to his wife. So how do we diagnose it? Well, first of all, it is in the previous time when we didn't have the magnificent diagnostic technology that we have today, we would diagnose it by examination, and we'd have a tuning fork and a patella hammer and a pin, and we would sort of isolate, knowing the nervous system very well and the anatomy and the function of various parts of the nervous system. We would isolate a lesion and then define the where it was and the likelihood of it being a tumor or a stroke, putting everything together. Now, most patients, if a doctor suspects it's a brain tumor, will be referred to a particular specialist in that area in most instances, and they will do an MRI scan. Often a CT scan, computerized tomography scan, but this will not, in a great many patients, diagnose it. The MRI scan is the ultimate indicator that there is what we call, in medical terms, space occupying lesion, something taking space within the brain or around the brain in the brain box, the skull. So that would be the way of diagnosing it initially. We still won't know what type of tumor it is and how malignant it is in many cases, and this will need then a biopsy, which would be done usually with a technique which we call stereotactic, meaning there are coordinates which are set up and aimed at the abnormality on the scan. And this is done by a neurosurgeon or radiologist, somebody very specialist. Now, this opens even many problems, because if the needle, you can imagine a needle going into the brain, pinch wanting to get tissue, and the tissue's got to be big enough to be analyzed. Otherwise, mistakes will be made on what the doctors are dealing with. This in itself may have some very small danger, particularly in very, very important areas of the brain which govern breathing or vital functions. So everything has to be thought about and weighed up. First, we get a long way with the MRI scan, with a very good experience of a radiologist, neurologist, neurosurgeon, general physician. We can say this is abnormal. Then we have to say what it is. To see what it is, we have to get a biopsy. Most people know what a biopsy is. We need a needle into this abnormality, we're getting the tissue. We have to weigh up, will this be dangerous or will it not? And so on and so forth. There are no real blood tests which most people think of as diagnostic in cerebral brain tumors, whether benign or malignant. Yes, a patient who already has a known cancer and we think it's spread to the brain, the first thing one would say, they have a cancer somewhere else, is probably that. Then there's a different process of thought. But in the main, CT scan maybe differentiate between the tumor and a stroke. MRI is the gold standard to find out there is a lesion. The biopsy then allows us to analyze that lesion. The analysis of that lesion is absolutely critical in order to treat the patient. Now, we're talking about, in the main, malignant tumors. It may, and only 50% of them are of primary brain tumors are malignant, and then they even fall into 4 grades of malignancy. So we're getting into more complex areas. But to summarize, MRI scan, question CT scan to differentiate from a stroke at the early day, MRI scan, biopsy, analysis of the tumor, and then it is extremely important, and I cannot emphasize this more, that in order to progress, both in diagnosis and then hopefully in treatment, and we hope there'll be better treatments in the future, and survival will be better, the analysis of the tumor has to be as exact as possible to know its genetic profile, to know its immunological profile. So we are now trying not only to diagnose there is a tumor, but to, as accurately as the present knowledge is, we are with the present knowledge we have at the moment, to narrow it down to its type, and then hopefully we will have tailor-made treatments for the individual type of tumor. Now, this applies to cancer in general, but it's particularly important in brain tumors where it may have a bad outlook in at least half of them. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.